my name's Carly. Welcome to this video on enteral routes of administration. Now, routes of administration are a lot like routes on a map. You can choose 100 different ways to get there, but some ways might be better than others, just like the paths that a drug would travel on to get to the body. There are a lot of different reasons to go one way over another, just like in nursing. You'll find that some pathways are better to use in certain situations than in others. There are also pharmacokinetic properties of a drug that are significantly influenced by the route of administration, like absorption, distribution, metabolism, and excretion. But we'll talk more about those in a separate video. In this video, we'll talk about specifically the enteral routes that drugs can be administered through, which is anything through the gastrointestinal tract. We'll talk about their advantages and their disadvantages, and an overview of how a nurse, like yourself, may or may not want to use them. Alright, let's dive in. There are 4 different types of enteral routes: oral, nasogastric, gastrostomy tubes, and suppositories. Tablets, capsules, elixirs, or suspensions are just a few of the forms in the oral route. This is anything that is taken through the mouth. The nasogastric route is a tube that is passed through the nose and then into the stomach. A gastrostomy tube is also called the G-tube. It's a tube that is inserted directly into the stomach through the abdomen that is generally used for nutrition support and getting rid of obstruction in intestines. The rectal routes are classified as gastrointestinal tract meds because they are absorbed by the rectum's blood vessels and flow into the body's circulatory system. Alright, now that we know what these routes are, let's get into the advantages and disadvantages of each. There are a lot of different forms that any specific drug might be available in, so we need to look at which form is the best one to use in a particular circumstance. The oral route is probably the most convenient and doesn't cost nearly as much, but it can sometimes cause irritation in gastrointestinal tracts. The nasogastric route has its advantages because it's temporary, so it's not as invasive as some surgical routes. The downside is that it can cause some nasal irritation and can be painful if you accidentally removed it. Now, the G-tube can be useful when the patient has difficulty swallowing. You can change most G-tubes easily at home. G-tubes are good for long-term use, but they do need to be replaced if you're using them for extended periods of time. Alright, now we've got a couple of paths to choose from on our roadmap to drug administration, so let's talk a little bit about some of the general guidelines to use while we're on our way. You're going to want to make sure the patient is sitting up and isn't going to have difficulty swallowing the medication. Be sure that the patient hasn't eaten any contraindicated foods and that they aren't likely to vomit after they take it. For nasogastric routes, make sure to place the tube correctly and rinse the tube with warm water before and after every medication so that you can prevent it from clogging up. When you're inserting anything rectally, oh no! Be sure to store it in the appropriate temperature and be sure to remove any wrapping on the meds, and please, wear gloves for the obvious reasons.
Recap!
So, to recap, we've gone over the enteral routes of administration: oral, nasogastric, gastrostomy tubes, and suppositories, the advantages and disadvantages, and of course, the most important for you, how to or how not to use them in the field. Remember to always be sanitary with any routes, and you'll do just fine. Alright everyone, thanks for taking a look with me at all these enteral routes. I hope we weren't driving too fast for you. If you liked this video and want to see more, follow the links below for more awesome and easy to follow videos. I'll see you there!